Hello, I'm Dr. Yogesh, Senior Orthopedic Consultant at Aster Whitefield Hospital. So today we'll be talking about the OG vitamin, vitamin D. So we'll be talking about what are the sources, what are the problems and how to treat it. So vitamin D is a fat-soluble vitamin which is mainly required for the bones to build up the strength of the bones because it helps in calcium absorption and also it recovery of normal functioning of the muscles, nerves, and also it reduces inflammation in certain scenarios. So vitamin D is very important. So what are the sources of vitamin D? We have sunlight, the main source of our sunlight, where the sunlight converts or activates produces vitamin D in the skin, which in turn helps in absorption of calcium and phosphorus from the intestine and building up the strength of the bone. And also fishes, so fatty fish, cereals and mushrooms and egg yolks, these are all the sources of vitamin D from which we can strengthen our bones. And also, what does this deficiency cause? So vitamin D, if it is low in you, then you will have this, your bones will become brittle, easy fracturing even with trivial fall, and also you will have mood variations, you will have lethargic feeling, you don't feel like to work, you will have hair fall, and also you will have mood variations with forgetfulness. So you tend to forget, you tend like nowadays, I forget things very easily, I forget where I have kept, I forget what I have told. So these are all the things, and these mood variations and forgetfulness comes only when the vitamin D is too low. Otherwise, usually it is the lethargic pain and most commonly the joint pains and the body aches, especially in the morning when you get up, with joint stiffness, especially with pains. So these are the common things which you have to look out for, and these things suggest that your vitamin D is definitely on the lower side. So what will you do when the deficiency is there or when the vitamin D is too low? First, you get a blood investigation done to look for vitamin D level, and then you go for treating it. So usually we put you on vitamin D supplements like in capsules, vitamin D capsules or sachets once in a week, that is 60,000 international units once in a week for 12 weeks, followed by a maintenance dose every month, same 60,000 international units. And diet, definitely diet is very important. As I told, as we discussed already, your whatever diet which is food in rich in vitamin D, that is important. And exposure to sunlight, this is very important. Most commonly the people come up with these questions, when should we stand in the sunlight? So the answer is in the noon, between 12 to 3 p.m., where you will get UVB rays. In the morning you get UVA rays, which does not produce vitamin D in the skin. It is UVB rays which produces vitamin D in your skin between 12 to 3 p.m. and even that time you should not stand for more than 20 to 30 minutes because UVB rays has also risk of developing skin cancer. So maximum 30 minutes, and you have to definitely expose the extremities like hands and legs, not covering your body and then standing in the skin. You should not stand in the sun covering your body. You should keep your extremities free or open, exposed to sunlight, and then stand in the sun for not more than 20 to 30 minutes. And last but not the least, physical activity. Definitely you need to have brisk walking at least for 30 minutes every day. So vitamin D is a combined effect. It's not like just I take with proper diet and my vitamin D is restored. No, it cannot work like that. It is like combined. You have to take supplements, good food, proper balanced diet of vitamin D, and exposure to sunlight and physical activity. So when you do all these things in a balanced way, definitely your vitamin D will be maintained normally. And also it's very important that you get your vitamin D checked once in a year, because you might be taking the supplement but your lifestyle is not going to change, that's going to be the same. So your vitamin D again tends to fall unless you're not taking a maintenance dose. So it's very important that you repeat vitamin D once in a year. If any queries, please do contact Dr. Yogesh at Aster Whitefield Hospital. Thank you.